Hi, I'm Joel Fuhrman. I'm a board-certified family physician and, of course, an advocate of a nutritarian diet, a diet designed to maximize human lifespan and prevent heart attacks, strokes, cancers, and dementia. I think we have this unprecedented opportunity in human history to use modern nutritional science to live longer and healthier than ever before. I got into this from my father when I was a child. So I started learning about, first, natural hygiene and reading all of Herbert Shelton's works that he wrote in the 40s and 1950s. I learned that in the 1960s when I was about 10 years old because my father was overweight and sickly, and we drove him around from doctor to doctor where he couldn't even sit up straight in the back of the station wagon on a mat. And eventually he learned, reading through Dr. Shelton's work, my father lost weight, recovered his health, and advocated and had us change the diet in our family to eat healthier. And I first thought he was crazy, but I started reading the materials when I was 11, 12, 13, and I realized that what he was telling us made a lot of sense, and that even though Herbert Shelton was a radical, he actually was something that we know today were people that were ahead of their time. And even today, living so healthily can be seen as radical by some people. And I've devoted my life to this. I went to medical school in the 1980s with a specific intent of being a physician specializing in nutritional medicine. Very blessed to have had a very rewarding career where I've helped thousands of people recover their health. And I'm always passionate about bringing this message out to the public. I've had 5 separate PBS fundraising pledge shows. I raised over $70 million for public television, and my shows have been one of the top fundraisers and successful shows on public television of all times, in the top 10 or 15 shows. Many thousands, even millions of people have been exposed to my work. My books, I have 7 New York Times best-selling books, which means many millions of books have been sold. So I'm tremendously blessed and grateful for that opportunity I've had to affect so many people in a positive way.
Would you say you were about 10 when you started doing this 100%?
Yeah, I'd say we were about 10 when my family moved into eating healthier diet. We weren't 100%. It took us years to go stricter and to learn more about it. And of course, as a kid, you're making choices that are not always wise, but at least I knew about it then. And as I got older, I became more of an advocate and more of an example of healthy living.
What year about did you begin doing it 100%?
This year?
No. No, seriously.
I think that we were still eating very healthfully in my childhood between the ages of 10 and 15, but as I was on the world figure skating team. I was actually 3rd in the world in pairs figure skating with my younger sister in the World's Professional Championships in 1976. And as a competitive athlete, we ate very healthfully and watched our diet and just for better stamina, not to get sick and to increase performance. So I was doing it back then in the 1970s. In my later teenage years, pretty strictly on a very healthy diet. And I stayed with, obviously, excellent nutrition throughout my training, throughout medical school, and obviously through residency and thereafter. And so way before I even started seeing patients, I was already a strong advocate and practicing these aspects of what I felt were so important for people to know.
Now, what does this mean? Like, how do you define your lifestyle that we're talking about here? Is it a whole food plant-based diet, and is it basically that simple, or is it a little bit more complicated?
Yeah, I coined a term called nutritarian because I can define what I want that to mean. Because what does plant-based mean anyway? I mean, plant-based, the American diet, the standard American diet is plant-based. It's more than 50% plants. It's probably 70% plants. Yeah. And what about, in whole foods? Well, is that mostly rice or is that mostly fruit? I mean, what are you eating? What's the whole food you're eating? So the nutritarian diet certainly is a whole food plant-based diet, but it's much more than plant-based. It's the majority, it's almost plant, it's not even more than plant predominant. But in any case, we're picking a wide variety of the healthiest plant foods, the ones that are not contaminated, the plants that are linked to longer lifespan. And that means eating vegetables. It's a vegetable-based diet. We're eating lots of vegetables, including green vegetables, mushrooms, and onions in the diet. It's not just living on a macrobiotic diet, which could be whole food plant-based, or a fruitarian diet, which could be whole food plant-based, or an extremely low-fat diet, we're avoiding all nuts and seeds and thinking that's the idea for, this is a sector of a whole food plant-based diet that is designed with, I feel, scientific integrity, leading to include a wide variety of foods that put together a dietary portfolio that will maximally extend human lifespan. And my also vision is that the same diet style that is best to prevent cancer, extend you slow aging, and prevent dementia is also most effective to reverse disease and be used therapeutically when people have certain conditions they want to get better from. Asthma, headaches, diabetes, high blood pressure, heart disease. When we're using diet nutrition as a therapeutic tool, the diet that's best for longevity also becomes most effective therapeutically as an intervention for people to get well.
Now, if somebody's seemingly healthy and adopt, a whole food plant exclusive diet, let's just call it that.
Whole food plant exclusive, but what I call a nutritarian diet.
Yeah.
It's much simpler, just call it a nutritarian diet.
Well, yeah. I'm just saying, if somebody's just healthy and they just want to do this for ethical reasons, let's say. If they're just eating like a variety of beans, greens, grains, fruits, veggies, mushrooms, nuts, seeds, herbs, and spices, you think that's probably going to be sufficient? In other words, is your diet more tailored toward people who are sick? Could it be that somebody who's healthy doesn't really need to be concerned about these details that you're talking about here for the nutritarian diet?
Sure. Are the nuances important?
Yeah. I mean, for somebody who's otherwise healthy.
Yeah. Yes, they could be. Let's take a fruitarian diet where a person's eating mostly fruit. It's not good for toddlers, it's not enough protein. Fruit's the only whole plant food that's too low in protein to maximize lifespan or survival. But people with middle ages in their 30s, 40s, and 50s even, have such a high degree of ability to digest protein, they even get enough protein from a fruit-based diet with a little bit of vegetables and nuts. If the diet is mostly fruit, 80, 90% fruit, it's not going to be good for toddlers, it's not going to be good for the elderly, because as you get older, your protein bioavailability, ability to digest and assimilate protein goes down. And then the IGF-1 could get too low and you get immune suppression, more tendency to infection like pneumonia, or because infection could be a cause of premature death as well. So that's an example. Or a macrobiotic diet where you're just eating mostly rice. We know how rice is so contaminated with arsenic today, and rice-based diets do not have the longevity, anti-cancer benefits of diet with a more variety of all these healthy plants we're talking about, onions and mushrooms and berries and seeds and green vegetables. So yes, the nuances are important if you want to have a higher probability of preventing causes of later life diseases. You certainly can survive on many different types of diets to reach a decent age of 60, 70, or even 80. But if you want to push the envelope of human longevity and live to what I feel is a natural lifespan for humans between 97 and 107 years old, then you got to do, in the majority of cases, then you have to do much more right, especially that the majority of these people, even though they may not have a serious medical condition, they haven't eaten healthfully their whole life since birth. So they do require more attention to nutritional excellence so the body can repair and undo the damages that they did through their unhealthy eating, decades of unhealthy eating. So yeah, I think it's important to eat green vegetables. We know that, for example, green vegetables we're a green vegetable dependent animal. The health of our immune system around the defenders at the gates of the castle, the intraepithelial lymphocytes that line the digestive tract, or their development is dependent on green vegetable consumption. There's a lot of cellular function and structure and ability of self-repair that's dependent on green exposure to compounds in green vegetables. So no, I am saying that you can do better outcomes with more specific information to make the diet more wholesome and to include enough nutritional variety. We're trying not to needlessly exclude certain foods from the diet. And that means including nuts and seeds and not thinking this myth that people have promoted that because nuts and seeds are calorically dense and high in fat, they should be avoided. That's not what the scientific literature shows. We have an overwhelming amount of corroborating evidence that the exclusion of nuts and seeds from a diet is not lifespan favorable. And so that could be a whole food plant-based diet. So I want to give people information that's more supported, updated, and not let them make these nutritional errors needlessly based on improper advice.
Yeah. So, but what I was saying is like beans, greens, grains, fruits, veggies, mushrooms, nuts, seeds, herbs, and spices.
Yes.
Are those categories in eating a variety within each?
Yes, that's a good, what you said quickly, greens, beans, onions, mushrooms, herbs, spices, all these things, fruits, vegetables, all those things. We want a variety of those foods in the diet. We don't want to be excluding and focus on one food. We don't want the diet to be based on potatoes with a little bit of, we want to have a good variety of foods in our diet, right? Variety of different types of foods gives us a variety of different types of nutrients, different types of fibers. We get more protein bioavailability by having beans and greens and whole grains and vegetables. We get a better nutritional profile when we include a variety of foods. And we have this unprecedented opportunity in human history to have availability of these foods, to eat a variety of foods. We should take advantage of it. That means we can do better than the blue zones do. The blue zones have a very limited exposure to foods grown that were traditionally grown in that area, or they're culturally used to eating certain foods, but they're not scientifically designed to maximize longevity. And they might get between 6 and 8 years longer than the average American lifespan-wise, but we can get 15 to 25 years longer by using this science, which I'm leading to a dietary portfolio I call a nutritarian diet.
I really do love all your talks. I've seen so many of them.
I know.
And they're so great. They're so great.
Thank you.
Some people in the comment section of my videos talk about oxalates, lectins, phytates, sopanins, or whatever, all these different things they're anti-nutrients they call. To what extent do people really need to be worried about that?
No, they shouldn't be worried about it really at all if they eat a variety of foods we're talking about. If they just lived on spinach and beet tops and Swiss chard, then they'd have to worry about it if they're eating only very high oxalate green vegetables. But who's recommending that? We're getting a variety of foods, and kale is not high in oxalates. Lettuce has almost no oxalates in it. Don't make raw spinach, more than a third of your raw vegetable salad, let's say. You want to have a low oxalate vegetables, so you get maximum absorption of calcium by not being bound by the high oxalate content. So spinach is rich in calcium, but because its oxalate content is relatively rich, it binds a lot of that calcium, making it not absorbable. But so as long as we're getting a variety of foods, which are some are lower in oxalates, some are higher, some are lower in lectins, some are higher, we're getting a wide variety of food substances, and then that type of lectin that we get exposed to in a wide variety of food actually has beneficial health effects. Not health weakening effects, but health strengthening effects, including anti-cancer effects. Keep in mind, when we take in phytochemicals that protect against cancer, if we concentrated them in a high form, like a pill, extracted them from the food and made it highly concentrated, they could have pro-oxidation effects and be harmful. But in the small amounts, and in a variety of many different hundreds of different types, they stimulate the cells to react against the mild irritant and become stronger and more protective against other toxins that the cells are exposed to. It's like running, or it's like exercise. When you exercise, you're exposed to oxidation and some stress on the body. But the body rebuilds back stronger in response to the stress of exercise. Now, of course, you can over-exercise, so much so that the building back in response to that stress can't compensate for the stress you got when you exercise too much. Then the stress is too great, and the building back can't compensate for that. So you could do the same thing with exposure to, let's say, a phytochemical. If you took it in a form that was in a concentrated form that you couldn't achieve from eating a natural diet. You tried to isolate it and take more of it that you think is good. You think this amount is good, a gram, take 100 grams of it. No, it's not going to be better. It could actually be worse.
You have a really interesting line of supplements. I actually think I would love to take them because sometimes I'm so busy, it's hard to just maintain this perfect diet that I'm trying to achieve here. And I feel like it's just the right amount of certain things that might be a little more challenging, like iodine, and what are some other things like that might be a good multivitamin of sorts? Yeah,
I'm saying that on a healthy plant-based diet, you're not getting ideal levels of all nutrients. And certainly, we're keeping in mind that some nutrients that are derived from plants, we don't want to get in supplemental form or synthetic forms. Because let's say there are over 100 different types of carotenoids. So we don't want to take a beta-carotene supplement. We want to get that from food with all the different variety of carotenoids. If you take just one, you're taking a large amount of one item when it should be eating the whole spectrum. The same thing with vitamin E. There are 8 different vitamin E fragments. We don't want just one of those fragments at a high dose. We want to get these things from food. Most of the nutrients that we should receive from food, not from supplements. We know from research, modern research, that taking certain nutrients have the effect to extend human lifespan and protect the brain against aging and protect against immunosenescence as we age, because as we age, our immune system gets weaker and we could be exposed to cancer, but an infectious way to death like pneumonia. So I'm saying here that zinc is something that we don't get optimal exposure on a plant-based diet. We get exposure but not optimal exposure to maximize human lifespan. So taking a little extra zinc is beneficial. And there are not 10 different forms of zinc that we're getting in the plant food. It's different than carotenoids or natural plant substances. Zinc is in plant food, but the phytates, of course, bind zinc and make it poorly absorbable. So vegans have a higher requirement for zinc. And there are numerous studies that show that prostate cancer, breast cancer, and especially pneumonia and infectious-related death is lessened and impacted significantly by zinc supplementation. So vegans don't have ideal amounts of zinc, especially as they age. It's well known that B12 is deficient on a vegan diet and can impair neurologic function with aging. And I met a lot of people here who I interview and talk about, and they're not even taking B12 on vegan diets. They're still, nobody talks about this enough. And the third nutrient I feel is so important, these omega-3 fatty acids, EPA and DHA, which I've seen in my career of more than 35 years as a doctor specializing in nutrition. And as the physician with the most experience, I think the most experience in the world, caring for vegan populations, elderly vegan populations, and seeing the problems that could develop in those healthy eaters. And we're talking about Parkinson's dementia syndrome with low levels of those omega-3 fatty acids. We're just wanting to make sure that those three ingredients, zinc, EPA, DHA, and B12, are supplemented appropriately. And likewise, iodine, vitamin D, K2 are also things that are probably of lesser importance, but also valuable. It looks like the scientific literature points to a high probability of making sure your vitamin D is in the normal range, and a little extra K2 or a little extra, making sure you have some exposure to iodine if you're not salting your food or you're not exposed to seaweed or seafoods, to make sure your diet is iodine adequate. When I design my own supplements, because I don't want people taking folic acid, vitamin A, vitamin E, and high-dose B, doing things that could be potentially harmful. I want to just give them what they need without excess that they don't need that could be harmful. At the same time, I want to give them not too high a dose, and not just think of a little is good, more is better, because some of the supplements have too high of a dose in it. Because we have a sweet spot of nutritional excellence where deficiencies can cause a problem, and excess could also cause a problem. In other words, as an example, look at the studies relating fatty acid intake to atrial fibrillation. There's a lot of studies that show that if your level of omega-3 fatty acids, you're too deficient, you're at higher risk of atrial fibrillation. But you take too much of those fatty acids to high-dose fish oil, it could even promote atrial fibrillation. You can show, that's not good to take that. Those high-dose fish oil can cause this problem and that problem. Yeah, but that might be true. But neither is to being deficient good for you either. You want to be in that sweet spot, and that's where I'm trying to be very comprehensive in my investigation of the research, putting together all the information to make sure people hit that sweet spot, not radical amounts or deficiencies. No deficiencies, no radical excesses, but at the sweet spot of nutritional adequacy for all these nutrients that humans need. Just like too little iodine can cause hypothyroidism, and too much iodine can cause hypothyroidism. So we want to be in that sweet spot, not to take too much iodine, for example, but not to take none, right? Not to have no exposure. So I feel that as a physician specializing in nutrition, I'm very conservative and thoughtful about making sure people don't make nutritional mistakes that can impede their future and lead to dementia or Parkinson's disease in later life. Because I've seen a lot of people on healthy vegan diets develop neurological issues in later life due to these things we're talking about here.
The omega-3 test that looks at levels in your blood.
The omega-3 index.
Yeah,
it's called the omega-3 index. Is the test to see if your level is adequate.
But now that isn't reflective of what's going on in the brain, though, right?
No, it's the red blood cell membranes. But your your overall years of exposure to the proper omega-3 index in your blood correlates with brain size and cognition later on in life. So you're right, at an instantaneous level, this 3-month window of your level in your blood may not be indicative of good brain health and good brain size with fatty acids in the brain. You may have had a low level that's been deficient for the last 50 years. And all of a sudden you're taking supplements and your level is good. It could take years or a decade to fix for the brain to get the benefit of that. Which means that it's just the same thing with salt exposure. Okay, you get to be 70 years old and you cut the salt out of your diet because you have high blood pressure. Well, you were just exposed to high salt for 70 years. You're not going to have normal blood vessels and just because you cut the salt out after 7 decades of eating too much. It's your lifetime exposure to salt that weakens the blood vessels, and irrespective of its effect on blood pressure. It damages the interior lining of the blood vessels. Just like decades of exposure to a low omega-3 index or a low omega-3 for the brain can gradually lead to brain shrinkage, which may start in middle life. At the time brain shrinkage really occurs in later life, it may be too late to just take the supplement for a couple of months or a couple of years even and expect to have normal brain size. That doesn't mean that it's not very important to have a normal omega-3 index. It just means that we have to start it earlier in life to give ourselves decades of proper exposure for the brain not to develop cognitive impairment and brain shrinkage due to omega-3 fatty acid deficiency. We know one thing with more than 20 different corroborating studies, that lower levels of the omega-3 index is linked to smaller brain sizes and more cognitive impairment with aging. That doesn't mean giving people a supplement when they're elderly is going to bring back the size of their brain. It might be too late for that.
But does it mean that giving them the supplement their whole life would have made a difference?
Yes, it means if they had the supplement a majority of their life, just like we want people to be off salt a majority of their life. We have adequate exposure to nutrition their whole life, not just let themselves become deficient and then at the last-ditch effort. It's like I always say, how stupid or how ridiculous is the position of the American Heart Association, which says that if you develop high blood pressure and heart disease, you should cut your salt intake back radically to not take in more than 1,500 milligrams of sodium a day. That is so ridiculous, because if it's right for people with heart disease and high blood pressure to cut back on sodium, and by the way, 90% of Americans develop heart disease and high blood pressure with aging. But if that's right to do it then it would have been right to cut back when you were younger to prevent it from happening. So it should be taught in the schoolrooms and reading, writing, arithmetic, and nutritional science, and everybody in the population should be reducing their salt intake. We shouldn't be waiting to develop disease. That's like telling a person, when you develop lung cancer, you better cut back and quit cigarette smoking. That's ridiculous, obviously. Well, there's the same thing with DHA. We're not looking to wait till people develop diseases to treat it. We want people to have the right exposure throughout most of their life to protect brain shrinkage with aging. Yeah. This is when the most benefits occur, right?
I understand there's 20 studies showing this.
Yes.
Are they showing that supplementing would work?
Yes, there were studies that show that supplementing would work. However, not once people's brains shrink. No. And the point I'm making, the later in life, the more old you are when you try to fix a deficient level, the more inadequate and the less the likelihood of that supplement's going to work. If you want it to work, you have to start it when you're younger. When you're younger, before your brain shrinks.
Now, aren't there certain seaweeds or even chlorella that has some fatty acids?
Well, all green vegetables have short-chain omega-3 fatty acids like ALA, and we can convert some of that into EPA and DHA. But the ability of the body to convert is very genetically determined. It's determined by what you eat, by your inheritance, your genes. And we've done studies on this, and we see that there's a tremendous varying ability of some people to make adequate EPA and DHA and other people not to make adequate.
You heard of Dr. Udo?
Yes.
He says you'll have symptoms like dry elbows, watery eyes, There's ridiculous. No symptoms related to this?
Absolutely not. The first symptom could be your brain shrunk. So the first symptom, B12 deficiency, could be irreversible neurologic damage.
He even said if you weren't capable of converting enough, you would just die right away.
Well, that's also incorrect, because vegans who are not eating any EPA and DHA have convert an adequate amount, even because the brain only needs a little bit for normal survival. So you don't need to supplement if you just want to live to be 60 or 70, maybe even 80 years old. And so we make enough for normal lifespan. If we want to have an extended lifespan, to make sure if you're going to live that longer and you want not the brain to atrophy in later life, then we're trying to do all the right things to maximize human lifespan. But yeah, if you're just talking about getting by and surviving to an average lifespan, then you probably could get by without it.
And your supplements, you're very careful, with the fatty acids, to ensure they're not oxidized.
That's correct. Yeah. I heard people even saying here at the conference that they have taken the fatty acids and they taste funny. They make them feel, they get indigestion from it. So well, that's because you're taking a rancid product. It's out of the refrigerator. It's not, So yes, because I've been involved with this for so many decades and actually treating, tens of thousands of individuals, following my advice and getting feedback, and knowing that about 20 years ago, when some people were getting a bad taste or indigestion or burping or from these omega-3 fatty acids, I would send them off to labs, independent laboratories, to have the TBA scores tested to see the degree of rancidity in the fatty acids they were using that I was actually recommending they use. And I found that many of these, as they stayed at room temperature for many months, 6 months, 8 months, 10 months, 12 months, as they increased the months at room temperature, they developed higher TBA scores and higher degrees of rancidity. So that's why I originally started procuring DHA for use for my family and my patients and my people so I can get a product that I keep refrigerated and keep it from becoming rancid and keep it fresh. So we're taking a fatty acid supplement, they have something that's fresh, not out of the refrigerator for a year and a half.
Accessibility, like these are kind of expensive, aren't they?
Yes.
So it's not like practical for a lot of people maybe that.
You know, there aren't many people who are vegans. Most people get their fatty acids from eating fish. And most humans on the planet over the last 100,000 years, people ate some animal products.
Well, like
frogs, snakes, fish, clams, whatever it is they ate, they got some exposure. Most people are not vegans. If we're going to go move to a vegan diet, and we're going to take a whole classification of food and push it off our plate for various reasons, mostly health reasons, then we have to make sure we're not pushing off our plate something that could be valuable in the process, and not be so cavalier or egotistical to think that what we are doing has no potential risks. And that's the problem. You have tremendous egos involved. Because whatever people say or have been said for years, they don't want to change their mind. As new research accumulates, they don't question their own belief systems. They're so egotistical to keep pushing what they've done for years when more evidence becomes available. So unfortunately, this happens in all fields of science and all fields of knowledge. People, they're resistant to change, and we see it in the nutritional field as well. We have to be conservative and make sure we don't gamble with people's lives because our own philosophies are rigid. So now it's most likely the case that we're going to extend human lifespan by exposing ourselves to some of those beneficial compounds that come from fish without taking in the toxicity of fish in the process.
And yours are algae-based, right?
Algae-based, that's correct.
Definitely. Raising children vegan from birth, is this something that could be more protective than not raising them vegan from birth, from chronic disease, premature death?
Most children can be raised on a strict vegan diet and do very well. And they do very well. If they have the right type of food, which means some more concentrated calories like nuts and seeds and beans, and not just live on fruit.
Yeah.
Right?
On the diet that we're saying is ideal.
The diet has to be well designed.
Yeah,
When
on a
you're
well-planned.
It's most likely the case that a well-planned vegan diet in today's world, properly supplemented, is more protective and lifespan promoting than one that includes animal products. Most likely. Apparently, it looks like that vegan children are healthy when they're raised on a careful diet. But that doesn't mean every child out of 1,000 is going to do best on that type of diet.
And couldn't the same be said for every diet?
Yes, that's true. And most people, as you know, are eating junk food, and parents feed them improperly. And as a physician, we have to try to cultivate good nutritional habits so children can don't have their potential impeded, which most people are.
What is an ideal day of eating like for you?
I keep my diet pretty much the same most days because I'll eat a different type of soup, but I'm still having a soup for lunch with a salad. I'll have a different salad dressing on the salad, but I'll also pretty much have various types of lettuce, some kind of green cruciferous like arugula or bok choy or kale mixed into it, or cabbage mixed into the salad, So I'll basically have a big salad with onions and with a nut and seed based dressing, not an oil based dressing, for a big salad for lunch with a bowl of vegetable bean soup and a couple of pieces of fruit. It's usually my lunch. My breakfast is usually a whole grain, a small amount of whole grain with some seeds, like chia seeds, flax seeds, hemp seeds, and maybe some walnuts, but usually seeds and a whole grain with berries and other fruit, and maybe some plant milk. But I don't recommend people take carbohydrate-based milks, like oat milk and rice milks. I prefer them to use nut milks, like hemp seed milk and walnut hemp milk and and almond milk. I want them not to take liquid carbohydrates.
What about soy milk?
Soy milk soy milk, I use that too. So my favorite milk is unsweetened soy milk. Is unsweetened soy milk with no ingredients, just organic soybeans and water, But yes, I use a plant milk like soy milk. And then for dinner, I'll have raw vegetables with dip, hummus dip, a salsa dip, a bean dip, a avocado dip, like a guacamole dip, with other raw vegetables I didn't eat for lunch, like peppers and snow pea pods and jicama and bok choy stems, whatever I'm eating for dinner. And then I'll have a cooked vegetables with my dinner, such as a Thai curry wok with broccoli and onions and mushrooms and snow pea pods and water chestnuts and bamboo shoots, or I'll take in maybe a pineapple, maybe I'll have a Hawaiian, or maybe I'll have a tomato sauce-based dish, and maybe I'll put some of it on spaghetti squash, and maybe I'll have mushroom Alfredo sauce on some vegetables. So maybe I'll have different types of cooked vegetables. And I do eat dessert at night. I do have a delicious tasting dessert, which then I feel is helpful for people. It's helpful for me too. It marks the end of eating for the day. So by 6 o'clock at night, I'll have some frozen banana ice cream, maybe some whipped banana with some walnuts and real vanilla bean powder and a little soy milk or something, or a little bit of piece of baked apple or some frozen cherries, some kind of healthy dessert. So it tells me, okay, that's it, done eating for the day, shut down the restaurant, clean your teeth, get away from food, and involve yourself with recreational activities for the rest of the evening without eating all night long. Have that space between finishing dinner and going to bed at night, where you can digest the food and go to bed on an empty stomach. So yes, so I feel that that helps me knowing if I had the dessert, I know I'm done eating for the day. Marks the end of eating for the day. But I'll vary the dishes, the sauces, the types of vegetable dishes, and as you know, I have cookbooks and menu plans, and I want people to recognize and to experience that healthy eating can taste delicious.
And do you try to eat within an 8-hour window?
No, I don't try to eat within an 8-hour window. If I say eat breakfast at 7 or 8 in the morning, but I'm finished dinner by 6 o'clock at night, so I have that 4-hour window before I went to bed at night. So to me, the window, let's say between 8 in the morning and 6 at night, is about 10 hours, right? So I'm probably eating in a 10-hour window most
so you're
days.
not like doing intermittent fasting, is it?
Unless you want to call it time-restricted eating, in the sense I'm saying the most important aspect of time-restricted eating that leads to longer lifespan is going to bed not on a full stomach, is going to bed on an empty stomach. So eating an earlier dinner, and a dinner not so heavy that you're digesting it through the night when you're sleeping. You can eat an earlier dinner and eat so much food that just digesting the food when you go to bed at night. You want to eat the amount of food you eat at night, and the type of food you eat and the time you eat should be sufficiently early and not so much so that you feel that you're finished digesting when you go to sleep at night.
And what kind of ratio do you think is ideal for raw versus cooked?
Well, there's a ratio of raw versus cooked that's acceptable, but usually it's about half and half. Maybe by volume it's more raw. Maybe I'm 3/4 raw to 1/4 cooked, or 2/3 raw to 1/3 cooked by volume on the plate. But if you actually calculated the calories, you'd see that it was about 50-50, and maybe even getting more calories from, maybe it's even 60-40 calories from cooked versus raw. But on the plate, the 40% of raw is actually by volume. It comes out to be like 70% by volume, by food volume. It's more concentrated on your plate. It fits into a smaller. So when I had when I was here, I had filled up my plate with salad, and I had a little bit of the cooked vegetables and cooked stuff. But if you calorically counted it out, you probably would be about half and half calorie-wise. But I also have cooked beans. But I also had raw nuts and seeds with the salads and with the raw vegetables.
Would you say it's easier to digest at night for your last meal, like a little bit more raw or a little bit more cooked?
I don't have a position on that. Yeah, you don't want to eat too much heavy food. Like eating too much.
It's a heavy food, I guess.
Like bean burgers or something, or bean burgers and tortillas, or whole grain bread with a bean burger, and eat too much of that food. You could be digesting, later into the night.
That'd be okay maybe for lunch, but at night.
Yeah, I know it's a little hard to digest that stuff. That's maybe if you know what I mean by having the.
So you're having more maybe vegetables and more raw.
Yeah, but I'll have beans, but not with the
Not with the tortilla.
Yeah, I'm just trying to be having a reasonable amount of calories so you're satisfied, being very cautious to not overeat at night and get up from the dinner feeling full.
Okay, so you have a supplement that's a multivitamin, and then you have the fatty acid supplement. Those are two different supplements. Do you take these with a meal? Do you take them at night, morning? Does it matter really when those are taken?
But it's better to take it with food, with a meal.
In the morning better, or at night? Doesn't matter.
matter.
Now you have a retreat that's called Eat to Live Retreat, is that right?
Yes, the Eat to Live Retreat in San Diego.
Tell us a little bit about that.
It's really like a great idea, because all my decades of treating people who were trying to have them eat healthfully, some people fail. They don't necessarily follow the program. They fall off the wagon, so to speak, and they lose weight and gain it back again, or they can't really give up their foods they're addicted to, and they just have trouble adhering to a healthy diet. So I knew that some people need to be in a safe environment where they can be forced abstinence from their addictive triggers, so they can lose the desire to kind of have those foods. And when people change their diet, we knew over the years when people go away for a week to a conference and learn how to eat this way, there's not a high probability of the majority of people making the change, because they're thrust back into their home environment and they haven't really gotten rid of their addictive connection between self-destructive foods. So my retreat is based on longer stays. The minimum stay is 30 days. We advise people stay 3 months who are overweight and who have food addiction. So it gives me the opportunity to have time pass so they can lose the strength of their addictive drives to want to eat unhealthfully. They can develop new taste muscle and build up the knowledge, both philosophically, emotionally, intellectually, and experience the pleasures and joys of living so healthfully. So they have the tools in place when they go home to be able to replicate this and not want to go back to their old way of eating.
To be a leader when they go back home.
Exactly. To be a leader and to be a role model and to enjoy eating this way. So I made a retreat in San Diego, mostly for people who are overweight and have medical conditions, but most of them don't have medical conditions. Most of them are just overweight and have trouble following a healthy diet. They're too tempted to eat foods that aren't good for them. But after they stay at the retreat, for a period of time, 2 or 3 months, they're better in control of their choices, and they can replicate what they learned there, and they can go home, and it dramatically increased the probability of them staying long-term. This is all about sustainability. They come to the retreat because your health is ultimately gives you your ability to sustain eating healthfully for the rest of your life, for years and decades, not for dieting and losing weight and getting it back again. There's no value to making a change if you're not going to stick with it. So we have people come to the retreat so they can learn to make the changes that they can learn how to stick with, and we have the tools so they do stick with it for the rest of their life. That doesn't mean we succeed in every case. We certainly radically increase the probability of that happening.
And what kind of other issues might somebody want to do this before? I know you said obesity. Could this work for somebody with type 2 diabetes and cancer and heart disease and any other kind of chronic disease?
I see a lot of people with high blood pressure and diabetes, obviously, because almost everybody has that when they're overweight. And I have a success rate of about 75% of type 2 diabetics becoming non-diabetic within 6 weeks. Within 6 weeks, 75% become non-diabetic. Within 6 months, 95% become non-diabetic if they stick with it. So we're saying here, yes, and same thing with high blood pressure, that they are able to reverse their high blood pressure, reduce their atherosclerosis, improve their vascular elasticity and the youthfulness and oxygen perfusion of their heart, get back to a safe state where they're not going to have a heart attack, and get off their blood pressure medications, off their diabetic medications, off their statin drugs. They feel better, concentrate better, they become more creative, more happy, and they're able to function and not have the brain fog that they had before they. So yes, as you get off those medications and you start feeling better and eating right, they all say the brain fog lifted, and they're able to focus better and be a better version of themselves.
What about like cancer? Have any luck with that?
I've been in practice for more than 3 decades now, and I've taken care of a lot of people with cancer. And obviously, cancer is a bizarre and aggressive and unpredictable disease, and it becomes more bizarre, unpredictable, and aggressive the longer you have it and the more advanced it gets, closer you are to death. So certain people have come to me close to death where we could not impact their cancer significantly, but you never know. I've had some people with metastatic cancer that have done really well and survived now 20 years, 25 years or more, and were supposed to die. But the earlier in the cancer you are able to impact their diet with a person with something like cancer, the more impact you're going to have it, perhaps extending their lifespan. Many men with prostate cancer whose PSA have normalized and went back the other way and actually have recovered from prostate cancer. I have many men.
Without any kind of surgical intervention or chemo or whatever?
That's correct, just with the diet alone. Yeah. And I have numerous people with non-Hodgkin's lymphoma that went away with no chemotherapy, just went away with the diet. And I have patience and experience with people with metastatic cancers like metastatic ovarian cancer that were supposed to have died, that have now survived a decade, 2 decades or longer when they were supposed to have been dead because their ovarian cancer never came back. And we think that the reason the long-term prognosis for ovarian cancer is so poor is because the cells that escape chemo are now more resistant to chemo. Those are the cells that escape, and when the cancer comes back 5 years later and starts replicating, it's hard to treat it because those were the cells that were resistant to chemo the first time, that escaped and started to replicate again and escaped the initial kill.
They've evolved.
Yeah. So when the immune system is improved to be able to ferret, identify, and remove stray cells, I see many of my patients successfully living and not have secondary recurrence of their cancer. And we think it's because their own immune system is so strong that those little stray cells are able to identify and removed by their immune system. It was an adjunct to chemotherapy that made the treatment work better and work effectively.
You know, obviously there's more to this than food, and like your retreat, you're doing more than just food, right?
Absolutely.
You guys are doing exercise, having fun, and teaching people how to live.
And teaching people how to look at life with a philosophy that's not going to be influenced by trying to impress other people, or letting other people go external, your self-esteem coming from external and not from internally generated. External generated from getting people to approve of you versus your self-esteem being internally generated from you having care and interest in the outside world and actually using creative goodwill for other people. We're trying to make it so people can be comfortable being different from others. And you don't have to get along eating what they're eating to have them like you. People are less dependent on having other people like them because they're going to then go off their diet if they're running based on the high need for approval from others, like a lot of Americans.
Eat to live, don't live to eat. I love that phrase, and I think a lot of people do.
Yeah.
It's so clever. It's like what I'm kind of trying to do. I'm trying to eat to live, but then I'm also trying to figure out, well, what's the best way to live? You know, sleep, exercise, all these things, and then put them into practice. And one of the things I've personally come up with is all these pillars are like the spokes in the wheel, but then at the center, love. If I don't have this self-love, if I'm not feeling love, none of this stuff really matters. Something that I've been kind of contemplating a lot lately.
Yeah, what you're saying is important because it has to do with, I want you to become the scientist and artist who specializes in you. So you are the best person to work on your own behalf to be happy and healthy. And you've got to become the expert in yourself to know the right foods, how much of the foods, how much sleep you need, how much exercise you need, what kind of, build your healthy relationships, so all these things that can build your health. But people are self-destructive. And they're pulled by addictive behaviors. They're not putting these pillars into action. If they realized it's actually for their own benefit, they'd not just live longer, but they'd live happier and more self-satisfied and more at peace if they did what we're doing, which is practicing the art and the science of trying to live our lives in a way that's going to be best for ourselves, be best for our own life. And that means to do that, we also want to have goodwill for other people. And because that's a healthy way of feeling good about ourselves, having creative goodwill for others, and caring about other people, because our happiness is dependent on our ability to have emotions for other people. And the more we try to elevate our own self-esteem by trying to get approval from other people and feeling superior or build those superior points, it could lessen our ability to care and to feel for others and even for people who are suffering. So part of the benefits to ourselves is to have the ability to feel for other people, care for them, love them, and want as much as we can to have goodwill for others as we at the same time are having goodwill for ourselves.
I got to spend a few nights at your house, and I kind of felt like a little private investigator of sorts. I was watching you, I was listening to you.
You were at my house?
You remember?
Oh, you slept over my house in New Jersey.
Yeah. I even watched you take your own supplements. I was like, well, you must believe in him if he's taking them. You would work out in the middle of the day. You were going to the clinic. You were taking care of your family. You were just non-stop wide open. And I'm like, man, this guy is just like a superhero. And I already felt that way, but then I got to see it, more personally. And even late into the night, I overheard you talking on the phone to somebody you were trying to help. You really do come across as like this badass, but at the same time, you're really just a big-hearted person.
Thank you, appreciate that.
So I just wanted to kind of get that out there because, some people might criticize you for selling supplements. I'm kind of like, well, if I believe in something, I'm going to invest in it, and I might even tell others about it. And I think that's genuinely what you're doing here. You believe that these things will help.
Yes, I think they're very important for people's use. And I'm trying to make the best quality supplement. So I can't do it without charging for it. And I had to do it because nobody else was doing it. I wanted something good for my family, my people, wanted to give them the right things. Yeah, but I'm proud of that. And it doesn't matter to me what other people think. Because I feel good about what I'm helping people live longer and be healthy. With the conservative use of supplements, not the excessive use of things they don't need.
Folic acid, you mentioned that earlier. A lot of people, a lot of vegans especially, use nutritional yeast, and a lot of times it's supplemented with folic acid.
Yeah, fortified nutritional yeast.
Yeah.
And I get it.
They get it because they want the B12.
Right.
And it's like you can't get the B12
without the folic acid.
Yeah, it's so annoying. But you have one that doesn't have it, right?
Yeah, not only mine. There are other brands. There's another brands you can buy that that are unfortified nutritional yeast.
But with B12?
No, with neither B12. It's unfortified.
Yeah, but I want it with just B12.
I don't want you to do that.
Why?
Why don't you just take the B12?
The
amount of B12 you need. Why depending on how much nutritional yeast you're using? Because you're going to use too much nutritional yeast.
So just get it unfortified.
Yeah, use nutritional yeast sparingly for flavor.
It's just good to get that out there because they're not thinking about the folic acid.
It's an important point that people know that that folic acid is not found in natural food. It's not the same thing as folate that's found in vegetables and beans. And folic acid is linked to increased risk of cancer, like prostate and breast cancer. And that it's not wise to be taking folic acid supplements in any form.
Even when you're pregnant.
Even when you're pregnant. People who are, so that's another, probably in my opinion, a strong cause of childhood cancer and increased deaths in this country. Because they give people folic acid when they're pregnant to prevent neural tube defects, instead of telling women they have to eat green vegetables to get folate. So they can take folic acid. It's like telling you to take diabetic medications for your diabetes instead of eating right and exercising to reduce your blood sugar. It's the same thing. Give them folic acid to help the neural tube defects, and they don't have to worry about their diet now and eat green vegetables. Why not just tell them to eat green vegetables to get the folate? Because now we find out that the leading cause of death in children, other than accidents, is acute blastocytic leukemia, a cancer that's linked in the scientific studies to lack of vegetables in the mother's diet, not just during conception, but also prior to pregnancy. And we have brain tumors in children that are linked to consumption of luncheon meats and bad diets, and we have autism in children linked to fast, junk food. So instead of getting women on a healthy diet to get their folate, and that will stop not only neural tube defects, but will stop other birth defects as well, instead of that we say, keep going to McDonald's and keep eating junk food and keep eating commercial baked goods and just take folic acid pills to prevent neural tube defects. It's a missed opportunity to tell women how important it is for them to eat healthy food so they have a healthy baby. So now we just let them eat an unhealthy food and we give them folic acid. It's completely the same thing wrong with, it's representative of what's wrong with healthcare and medicine in general.
And I've heard you say things about getting certain procedures done might be risky, mammograms, for example. Am I understanding that correctly?
Well, I think the main point I want to make is that adherence to healthy living is much more protective against cancers and breast cancer than prostate cancer and colon cancer than screening tests are. And the idea that the medical profession screens people but doesn't advocate an anti-cancer lifestyle and diet, that itself is way out of proportion, because these screening tests like mammograms and colonoscopies and prostate exams are very controversial and don't do much, if anything, to extend lifespan. They might reduce breast cancer mortality, but not overall mortality. Even taking blood pressure medications and statin drugs doesn't have a dramatic protective effect on overall mortality. It may reduce cardiovascular death from people who have cardiovascular disease somewhat, but the effect on overall lifespan of the population, it doesn't really have much effect. What I'm saying is that the money, the effectiveness, isn't getting people to change their habits and have good, healthy, nutritional habits. And we don't focus on that. We focus on screening tests. Screening tests are, you can, whether you do it, whether you don't do it, that could be an individual decision between you and your doctor, what your benefits and risks are based on your lifestyle. But the bottom line is, that's a much more unimportant argument than the lifestyle you're choosing to live on and the foods you're choosing to eat. Those have much more impact on your health than whether you screen or not. Everybody has a risk versus benefit ratio for screening tests. For example, colonoscopies, where they put a tube in your colon, have overall a beneficial effect on people eating a standard American diet, finding polyps and removing them before they can turn into colon cancer. So there may be some life years saved by standard American diet, taking colonoscopies based on the benefit of the colonoscopy versus the risk of colonoscopy. The colonoscopies have a risk. They can perforate your colon. They can cause an infection. They can even cause some people to die. But overall, they're going to have a beneficial effect because more people are going to benefit from it and they're going to be hurt from it.
Yeah.
But now with regard to me, as I explained earlier, I've been eating a healthy diet since I'm 10 years old. My personal risk of colon cancer is so infinitesimally small or non-existent that I would be increasing my risk of death if I had a colonoscopy, not decreasing it. So the recommendation to have a colonoscopy maybe should be based on your individual risk versus benefit ratio. So we're talking here about the fact that the healthier you're living and the more decades of living healthfully, the less the need for those screening tests would be. And probably on an aggregate level, you'd see more damage. The benefits would be less in a healthy living population.
Now, a lot of people claim that they're getting success treating chronic disease with the ketogenic diet, for example, or even going carnivore. What's going on there?
You can generate a hypothesis based on short-term benefits. Like smoking cigarettes helps people lose weight. If you smoke cigarettes and snort cocaine together, you can keep yourself pretty thin. There are a lot of thin alcoholics too, but I don't think we'd suggest going to bars and drinking and smoking as a means of controlling your body weight. That's only short-term benefits. When you control your body weight and you're eating more carnivorous type diet, you may have lower glucose. You may be losing weight and you may have your triglycerides go down and your glucose may improve. And you can do that with smoking too. But the question is, does that translate into longer lifespan? And does it translate into a longer lifespan when compared to other ways of eating that could have also controlled your glucose or made you lose weight that are safer? Just because it works in the short term doesn't mean it has long-term benefits. And we have too many corroborating studies today, long-term studies following people to endpoints of death, showing that those diets increase risk of premature death.
Even the carnivore one?
Well, we're saying that animal protein in the diet increases risk of both cardiovascular death and cancer death in a dose-dependent manner the more you increase the consumption of animal protein in your diet, animal products in your diet. So the carnivore diet theoretically should be the most dangerous diet because it has the highest percentage of animal products. And we have a lot of evidence to show that's true today. And the evidence comes from people eating diets that are carbohydrate restricted, like keto diets where their carbohydrates are held below 30% because they're trying to keep in ketosis. And those people have the shortest lifespan of any group tested. So we know those diets are exceedingly dangerous. Remember, short-term benefits generate a hypothesis, not a conclusion. To have a conclusion, you have to do a combination of short-term benefits and long-term benefits, where you follow people, groups of people, large groups for decades. In other words, 3 criteria for high credence studies. Large numbers of people, followed for decades, looking at hard endpoints. Hard endpoints means heart attack or death or age of death, not the triglycerides went down, or they feeling better, or they're lost weight. Because lots of ways you can lose weight, but the question is, what's the healthiest way that you're going to stay with for the rest of your life, and you're going to stay consistent on? We're talking about sustainability of a diet and staying with it so you can maintain the benefits and so it extends your lifespan. And then there's no question that keto, carnivore, paleo diets are dangerous comparatively to diets that are healthier. A paleo diet might be better than the standard American diet. When a person's living on fast food and processed foods and bagels and fried foods, of course, that's, the southern diet with all the fried foods, that's so dangerous and so harmful that if people move more paleo, they're moving in the right direction.
So now you've got 7 bestsellers. What are they called? Name them real quick.
Yikes. I didn't know I could do that. Let's name my 7 bestsellers. Okay. Eat to Live, Superimmunity, The End of Dieting, The End of Diabetes, The End of Heart Disease, Eat for Life, and I'm missing one.
Is it your most recent one?
That's Eat for Life.
Okay.
That's 6. Oh, I got it. The Eat to Live cookbook is my 7th. The Eat to Live cookbook. I got all 7. I've written 13 books. Yeah, the books that I have not become bestsellers, which are still good books, some of my favorite books. Disease Proof Your Child was not a bestseller. Fasting and Eating for Health was not a bestseller. One of my most favorite books that I've written, Fast Food Genocide, was not a New York Times bestseller. So there's other books that I've written that are still good books that are not New York Times bestsellers. I recommend people read Fast Food Genocide. It's a very interesting and important book, but it's not going to be a bestseller like The End of Diabetes or The End of Heart Disease or because it's not going to appeal to such a large number of people. You can appeal to more people who want to lose weight, or self-help books will sell better than a book like Fast Food Genocide, which is more historical and informational and educational and interesting, but still motivational, an important book. Oh, well, thanks for asking that question. It made me have to memorize. It made me have to identify my 7 bestsellers. And isn't that something? I mean, wow, that I have 7 New York Times bestsellers. That's amazing. Can't know how that happened.
Somebody like me, who's predominantly a whole food, plant-based, a little junk food here and there, which book do you recommend?
I recommend my most recent book, Eat for Life. Okay. It's most updated, has the most updated research in it. Eat to Live was my #1 New York Times bestselling book. It was top of the New York Times bestselling, that category of books, for like a long period of time, like a whole year. And sold several million, multiple millions of books were sold. My other books were New York Times bestsellers, but not as great as Eat to Live. That's why I call it the Eat to Live Retreat. I'm well known for that. People heard of that book a lot. Nevertheless, I'd still rather they buy Eat for Life and not Eat to Live, in spite of the fact that it sold many millions of books, because that's still written over a decade ago. You know what I mean? You want to get the most updated research and most updated science. So that's why, write more books.
Your website is just drfuhrman.com, right?
Yep.
And they can get your supplements there. They could check out your retreat there.
And I also have an Ask the Doctor forum and a membership there, where people can join the website and ask me questions to get guidance to help them. So it's one of the aspects of my career is that I give people through the internet some help and guidance, camaraderie, motivation, and membership, to help support them in their life.
And they can join your newsletter. I'm on your newsletter. I get your emails.
And I do podcasts with the Eat to Live podcast with my daughter Jenna. Check it out.
And you got recipes on there too.
I have more than 2,000 recipes. Is it 2,000 recipes or 20,000? I think it's 2,000.
Okay.
Yeah,
it's a lot.
It's a
thousands.
lot. There's thousands of recipes there. There's a lot of recipes there. And
more than enough.
You can put in this type of recipe, like a kale recipe, or the most favorite salad dressing recipe with the best ratings. And people can search and have fun with it.
What are some of your favorite tools in the kitchen?
Well, I have Vitamix.
Immersion blender.
No, I don't use the immersion blender. I cream it better in the regular Vitamix.
Okay.
Because I make sauces, dressings, ice creams, things in the Vitamix.
Is that like your main tool?
Yeah, except I usually make my dog food for my dog by dumping the leftovers of our food into a food processor with an S blade, and I put it in there because it makes it easier to put it in and out of that. It's a big base food processors are not a Vitamix I use for the dog food. Most of the foods she eats are either foods that I'm designing for her. She has her own personal chef, me. The dog, I'm the chef for the dog.
For the dog.
I work for the dog, thank you, that's right.
There's a lot of people that are raising their dogs plant exclusive, and
Yes.
like I have a friend whose dog's 23 years old,
Yeah.
plant exclusive,
Wow,
and Bramble was one of the oldest dogs plant exclusive.
I don't have to give her animal products. I'm giving her a little bit of animal products in the diet. Because, I'm experimenting. I have 100 dogs. I'm saying giving some of them plant. No, I'm just kidding. I'm just making a joke. I'd have to have 100 of the same type of dog. I have 100 Beaucerons, 100 Dobermans, 100 Rottweilers, 100 Rhodesian Ridgebacks, and I have 100 of each dog, and I'm giving them each a little different diet and checking out how long they live. That would be a fun study if I could do it, but I don't think I could care for 500 dogs. There's no studies being done on this stuff with dogs either,
I mean, didn't Linda, V-Dog, wasn't it based on some studies?
So few studies on dogs, and especially large numbers of dogs, the same type of dog, and modulating their diet and see how long they live like we do with humans would be interesting.
So what's next? You got another book coming?
No, but what I'm working on now, it should have out soon, is a new study. I've published about 20 different studies in the scientific literature, the medical journals. I'm ready to publish this last study, which follows 50 long-term nutritarian women with longevity markers and cancer markers, like telomeres and epigenetic changes and methylation defects, and getting a biological age on them and comparing them to 50 standard American diet-eating women, showing that their measurements of their biological age are superior to standard American diet-eating women. That's the next study I'm publishing soon. Wow. So we're actually at myself and my team at Northern Arizona University, and Dr. Jay Sutliff is the chief investigator on that study. So that study should be coming out. It should be ready to be written up. We're getting all the data collected now,
How many years have you been working on that?
5 years.
Don't you have a site that's Nutritional
Yes,
Science?
Nutritional Research Foundation. Okay. That's the nonprofit arm which we try to raise money to pay for nutritional studies.
And is that the URL, Nutritional?
It's nutritionalresearch.org.
Okay.
Nutritionalresearch.org. That's the Nutritional Research Foundation.
That's something cool to check out for sure.
Yeah, that's cool.
Yeah. We're at the National Health Association conference, right?
That's
75th
right.
annual, right?
We're at the 75th annual National Health Association conference. It was originally started as the American Natural Hygiene Society. But can you imagine this has been around for 75 years, advocating similar message in lifestyle medicine and nutritional excellence for decades and decades and decades, largely ignored, through all those years, but now getting more play and more people are interested in this subject.
Yeah. And didn't it kind of start back in the 1800s?
Yes, Dr. Trail and Dr. Jennings were some of the early founders in the 1800s. But Dr. Shelton continued those work in the 1900s. I think he was born about 1920, 1930. He started writing books in the 40s, 50s, and 60s, 1940, 1950, 1960. He was very prolific, wrote about 30 books. He put out a hygienic review that I read every week with my father. Shelton had the precursors to Shelton, were the people that started out with taking people off dangerous medicines and leaching and cupping and bleeding people and getting them on healthy living and healthy diets back in the 1800s. So this has been around for a couple of hundred years, and still never quite hit the amount of mainstream acceptance that you would expect with the growth of the drug-oriented, because there's money in it and perpetuates itself because of the money to be made and so many people gives careers out of. But lifestyle medicine always took a second seat. But now we do have the growth of the American College of Lifestyle Medicine. Many more doctors interested in this. Now we're here at the National Health Association celebrating their 75-year history and the fact that this is not something new that just came into being just in the last few years.
Like the carnivore diet.
Correct.
When people talk about the carnivore diet, I'm like, there's no evidence. And they're like, well, there's thousands or hundreds or whatever people in a blog somewhere, boasting about the of benefits or whatever, anecdotes. I'm like, well, we've got True North, Hippocrates Wellness, we've got American College of Lifestyle Medicine, we've got Academy of Nutrition and Dietetics on our side, we've got NHA, we've got
the World Health Organization.
There's a lot on our side.
We have a lot of corroborating studies showing that when you take out animal protein, you put more protein-rich plant foods in the diet, people live dramatically longer. Yeah. And we can control lifespan tremendously by reducing animal protein. And they're going in the opposite direction.
What's the most compelling evidence?
I think the most compelling evidence is those long-term studies following people eating higher levels of animal protein for decades. We have studies on following large numbers of people. We're talking about many tens of thousands of people for decades and seeing how long they live and what they die of. And these studies corroborate each other, and by different researchers, different parts of the world, The studies have to do with animal protein versus plant protein diets and longevity and survival. And you'll see many studies come up on this subject. But you can't just put meat and animal, you have to put animal protein versus plant protein. Because the studies on meat and animal protein show when people try to reduce meat, they don't live longer because they eat more chicken. And chicken is just as bad as meat. Or they eat less meat and they eat more white bread and white pasta and more eat more junk food or more sugar, sweet and high carb. And then it's not going to live longer either. You have to go to the study. The key here is plant protein versus animal protein. So it shows you that because rich plant protein foods are whole foods like seeds and nuts, beans, whole grains. So they're using whole foods. So it's plant protein compared to animal protein, foods that are rich in plant protein, not oil or sugar. So in other words, when you look at the studies, they show an overwhelming amount of evidence that you're going in the wrong direction when you're increasing animal protein in your diet.
Awesome. You going to Aspen this year for skiing again and inviting people or what?
No, probably not. Because Martin Oswald, the chef in Aspen who used to always make our meals, has moved back to Austria. So I'm probably not going to go back there because I don't have access to the same chef and the same restaurants that served our food. He had some of the only nutritarian restaurants in the world were in Aspen, and now they're not there anymore.
Are there any nutritarian restaurants in America?
There's one in like the Washington, D.C., Maryland area. There's some in California, but not you could say totally nutritarian. Like even on Google campus, there's a restaurant for their employees called Nourish, and Jack Hunt is the chef, and he knows a lot of nutritarian, serves a lot of nutritarian foods there. So there's a lot of nutritarian food available.
If somebody wanted to start a nutritarian restaurant, would you be affiliated with that in any way, or could they just do it?
I wouldn't want to be affiliated with it.
And could somebody just do it and call it that, or would they get in trouble?
They could ask my permission to use the word nutritarian, and I did have to trademark it because if I didn't trademark it, somebody else would have trademarked it, preventing me from using it. Yeah. But certainly I'm not looking to occupy the word and prevent other people from using it. If somebody wanted to use it, they could, but they'd have to ask me for written permission. Any
last-minute encouraging words or a quote?
Well, just never give up. And don't be satisfied with being sick and taking drugs. And don't think you have to be on drugs the rest of your life. That if you're breathing and you're alive and watching this, you can make choices that can improve the quality of your life. It's crazy to be self-destructive and be your own worst enemy. You should be your own best advocate, and you should make choices that are good for you, for your future.
Well, thanks so much for your time. It's precious and it's invaluable.
Thank you.